Good afternoon. Welcome. My name is David Smith, and I'm the president of the Forage Center for Peacebuilding and Humanitarian Education. And I'm glad you could join us this afternoon. We're talking to you today. Most of us are on East Coast time, so it's 4 o'clock where we are, but I imagine some of you are in different time zones. So wherever you are, good evening, good afternoon, good morning, good night, whatever the circumstance may be. So I wanted to spend just a minute telling you a little bit about what the Forage Center does, giving you a sense of our history, our work, and then giving you a sense of what we want to accomplish today. So first of all, I want to thank you for carving out an hour of your time to meet with us and to talk about experiential learning, simulation work, exercises, particularly the types of exercises that focus on promoting peace building and humanitarian education. Forage Center is a not-for-profit, non-governmental organization based in Washington, D.C. That was established about 5 years ago, but the work of the Forage Center goes back about 20 years. For the last 20 years, those of us who are the core of the center have been engaged in advancing humanitarian and peace building education using simulations and experiential learning. Our work was first launched by our mentor and teacher, Paul Forage, who passed away several years ago. Paul Forage started doing his work in South Florida back in the early 2000s, and we were all drawn to his work and the value of using full immersion simulation to teach students and professionals about what the work is like in crisis emergencies. So situations where often you're dealing with a humanitarian crisis that may be characterized by both man-made and natural disasters. So for the last 20 years, and as the Forage Center for the last 5 years, we have been running full immersion simulations around the United States, first in Florida and most recently in Western Maryland, where we have a center in Garrett County. We do a simulation once a year for the most part, but we also do smaller programs on site at colleges and universities, and we're open to doing programs and learning in really lots of different types of environments. So business, industry, law enforcement are interested in the work that we're doing. We're prepared and we're positioned to help out. So we encourage anyone in this group who's interested in our work to reach out to me. So the objective today is really to talk about making the most of your training exercises, to getting you to think about, those of you who, for instance, are educators and trainers, to thinking about best practices and things that you're using in your own programs. We're going to have 3 Forage Center staff: Lena Chowdhury, who's a program specialist, Peter Reynolds, who is the vice president of the Forage Center, and Jess Bonham-White, who's the director of education and training. We'll talk about different perspectives of training. But at a certain point, we're going to ask you to give you your ideas. If you're students, we want you to think about what type of learning would best advance your own aspirations and your own work and what you want to do. A lot of us now are working from home. We've got plenty of time to think and to deliberate about what our future is like. And also, you know, the existential crisis of the COVID pandemic is really getting us to all think about what it really means to work in a humanitarian context, because in many respects, what we're dealing with today is a humanitarian crisis to some degree. I just want to remind everyone that this is being recorded, to let you know that, and also to let you know that after the program, we will send out a survey. So the way that it's going to, the agenda is going to be that after I'm done, Lena Chowdhury will speak about her work and ideas with regard to public health. Peter Reynolds will speak, and then Jess Bonham-White would speak. I'm going to ask people to hold their questions, though if you want to put your questions in the chat box before we actually put questions out there, that's fine to do, though we won't be answering questions in the last 15, 20 minutes of the program and do it through the chat box. At the very end, I'll come back in and make some concluding remarks, so we'll go from there. All right, so thank you very much. I'm going to turn it over to Lena, and you're up, Lena.
Hello, everyone. Thanks for coming. Great to talk to you. I was asked to speak about public health and how we have incorporated that into our simulations and into our trainings, and really discuss some of the leading topics that we have found are areas of public health that maybe you're not aware of, or maybe you are, and how we have incorporated that in simulation. So one of the first topics that comes up is when you're providing aid for people who are displaced, and it could be because of disaster, it could be because of civil unrest. COVID is a great example. How do you provide that aid? And it doesn't have to be that you're a healthcare provider. It doesn't have to be that you're providing any kind of medical aid whatsoever. But how do you provide any kind of assistance and at the same time keep yourself safe? And so we have tried to incorporate that in our simulations by, in some instances, we have had our participants simulating providing just basic assessment in a zone of conflict. And then they're introduced to role players who are also experiencing signs of cholera. And we've provided them with training and experiences and some debriefing as to what do you do with people who are coming to you for assistance and they are experiencing medical issues, and you want to provide them with aid and you want to provide them with help, and at the same time you have to make sure that you are safe. So what do you do, and how do you deal with not only the logistics but also the ethics? You have people who are coming to you for aid and they are dehydrated, and you have a limited quantity of hydration to support your work. Do you give it to them? Do you keep it for yourself? Are you adding to the problem? We saw that in Haiti, where tons of people were coming in trying to provide aid, and they had all the best intentions, but they only added to the burden, because now we had to find a place to house them. We had to find water and food to support them and medical services. So that's an issue that we find comes up in every simulation. The other area that we hear over and over again from staff, from our board members, from people who are doing the humanitarian aid, is how do we protect the mental health of our aid workers? They're put into situations, again, I'm thinking COVID is a great example right now. Everybody, whether you are working in the field, in the hospital, or you're providing logistics, like you're working for Uber Eats, or you're working for Instacart and you're delivering food, you're providing all kinds of services for people in this crisis. But how does that impact your mental health? How do you protect yourself from burnout? How do you keep yourself safe? And so that's another thing that we try to, actually, we don't even have to try to incorporate into our simulations, because most of the people who come to participate have all dealt with some trauma in their life, whether it's related to their work or whether it's related to their own personal life. And when they're in these simulations, it brings up those trauma. And so we have to prepare them. How do you identify that it may be affecting your mental health, and how do you support each other? So those are areas that commonly come up in our simulations, and we think it's really important that you plan ahead on how to address that and how to protect the participants, even in just a simulation environment. So I could go on, but I think it's best if you hear from several of us and you get a variety and hear what others are doing. So I appreciate your time, and that's it for me for now.
Thanks, Lena. We're going to spend the next couple of minutes looking at messaging and media impact and the things that, sorry, David, you're going to speak. No, David isn't going to speak. One of the things that you might like to consider when you're planning training and doing training is that there has to be a consideration given to that your actions will hit the media in one way or another. And it could be in a newspaper, it could be a television crew turning up to talk to the humanitarian workers, or it could be people sending Twitter messages which you're not particularly happy about. One of the things I would like to have considered during these training exercises is, how do you run your internal and your external communications? What sort of messages are you sending to the people that work with you, and what sort of messages are being given to the audience and to the people who've been affected by whatever tragedy has come to pass and you're there to help? Do they get the same messages? Do they get different messages? In my third point on the slide, you'll see consistent messaging. One of the fundamental challenges that the current crisis has shown is that there has been a little bit of inconsistency in the messaging from different levels of the organizations attempting to tackle the coronavirus. And one of the fundamental things is, before an training exercise takes place, everybody who participates needs to know why they're there, what they're going to do, and how they're going to address the problem. And everybody needs to understand that. Not unnaturally, there will be some conflicts along the way, but one of the reasons we have country directors, senior managers, middle managers, is that they are there to assist the humanitarian workers at the coalface to get the right messages to the right people. One of the reasons we do messaging is to let people know what's happening. If they have the knowledge to be able to assist them in their daily life, how to get help, where to get help, what sort of help they can expect to get, that will make them better informed. And if they have better understanding, that will get you their support in the long term. We tend occasionally to forget that different people at different levels of what you're dealing with, the local government or the local population, may not need to get the same messages, but they need to get a consistent message from an overall strategic viewpoint. One of the things that we train when we do field simulations here is that we tell everybody they have to tell the truth. If you're ever caught out in a lie by whoever, it will come back and bite you. And there are some principles that we tend to apply all the time. Always be to the point, always be transparent. If you're not transparent, people tend to lose trust in the work that you do in the field. And if they don't trust the work that you do in the field, you're not going to be very successful. Also, never break your promises. So one of the major functions that we have as humanitarian workers when we do field assistance is, don't promise 50 gallons of water per day per family if you can't actually deliver 50 gallons of water per day per family. Don't ever speculate or stray from the topic when you're talking to journalists, particularly. Nothing is ever off the record. And be positive. Humanitarians have to be empathetic, have to be positive in order to give people confidence in what you're doing is correct and that you're going to be there to help them. And the ultimate thing is, never betray anybody's confidence. The personal information and the private information of casualties, injured people, is something that should always be kept in. Nobody should ever blurb about the numbers of bodies and things that they've seen. Those are not the sort of things that will get you support in the long term. So the things that you might consider is that you might consider organizing media facilities. Actually training with a group of simulated journalists so that all the students that you put through this course get to answer questions, get to practice, get to understand what the messages are, what the organization does, and what they do. Your most successful representative of in any organization is the field worker who has a thorough understanding of what he's just been through and can describe it succinctly. I'd like to leave it there for now. If you have questions, please come back to me after me, contact me separately, or leave me a question on the chat line. And I will now hand over to Jess.
All right, I hope everyone can hear me. I'm actually going to talk a little bit about two areas that are interrelated and actually have a lot to do with what you've already just heard, both from Lena and from Peter. My background is in anthropology, and so one of the things that we always have to remember is that any response, and I know you hear us saying humanitarian response, and sometimes we think about humanitarian response as someplace as happening somewhere else, when in fact, anytime you aid your community, you are participating in a humanitarian response. So the very things that you're seeing now happening out in the COVID world, in your neighborhood, in your town, in your state, you are in some way participating in a humanitarian response. And we have to remember that all responses and also the recovery happens in a cultural context. It happens in a local context. It sort of happens at a middle level context, and it happens at a global context. And one of the big words that we hear a lot about in crisis management or emergency management or humanitarian response is resiliency. And in the end, a resiliency really does largely depend on all of the partners in those processes, right? So those are the organizations, those are the first responding agencies, those are the public health workers, those are the volunteers, and they're also the community members. And we always have to remember that our community members are active participants in the response. And so, as you've already talked about, those interactions with people are very important. One of the things, the first thing I'm going to talk about are thinking about community resources. And once again, a resiliency really does depend on how partner organizations and individuals work with one another. And thinking about that many of the conflicts that we see in the after action reports, when we go back and we look and we say what worked and what didn't, very often the thing or the concept that creates sort of the lack of interagency, a cooperation, is actually understanding what the missions of all the organizations are, right? All organizations, if you are in one now, if you're part of an agency, if you're a student at a university, your university also has a mission statement. And sometimes what tends to happen, or what can happen, is that in the mix of things, you either walk outside of that mission area, there's mission creep, and you begin to sort of be doing things that sort of is outside of your area, or there's a misunderstanding of what that mission actually is. And so we actually see agencies begin to turn on each other as, well, I don't know why they're doing that. This is why we're doing this. We can't depend on them anymore. And so those are actually some of the things that we at the Forage Center, we insert into our training so that we understand how to think about how that process begins, where the information flow ends, because oftentimes it's, as what Peter said, it's information flow. And then how we think about mending that, either in our public messaging or even in the messaging that we're doing internally, and how we get everyone to understand what everyone else is doing. We've seen in the past, once again, in sort of in the throes of crisis, sometimes missions will, or organizations will say, well, it's them, when in fact we're all working on the same team, and sometimes it really is about clarification of mission. So we often have in our scenarios and in our trainings, we have an insert where there's a mission problem or a mission question, and we have our workers through that so that they know how to ask, right? And they can actively ask those questions of stakeholders, they can get that information, and then they can see how the misunderstandings may end up impacting those crisis affected people who are depending on you to build those networks, right? We often also insert what happens if your own mission is challenged, right? If there is something, if there are questions by the public as to why you're doing what you're doing, or isn't this your role, why aren't you doing it? We actually try to do that. Also, I'd like to talk a little bit about community tension. And this is something that I wish we could all say didn't exist. But it's something that we know is a reality, and Peter talked a little bit about it, and particularly when it comes to public health, where there's this unseen threat or an unknown threat. Very often we personalize the threat as human beings. You may or may not be seeing this in your community now, and so these are the sorts of things that can actually keep people from getting to assistance or thinking that sort of it's safe to actually get assistance. And so for as much as we'd like to be able to say, yeah, there's conflict about this, there's histories of discrimination, or there's narratives of racism or sexism or classism, or sort of all of the social ills that we talk about in social sciences, sometimes we just want to put that away as sort of, that's not in our wheelhouse, that's politics, and we're not doing a politics. You actually are. And what that means is that there is room for you to create new narratives, and there's also room for you to very easily escalate those negative narratives. And so very often what we try to think about as we build our scenarios and build our training exercises, we don't try to build them in a everything's fine world. We really do try to contextualize that an event is happening, but there's also these larger issues, right? So we really do try to think about creating, to the best way that we can, a situation of a complex emergency. So is it that people aren't getting to shelters because they don't have transportation, and that's what we're dealing with? Or are people not going to shelters because they're afraid to go to shelters because of some underlying community issue that is now layered on top of the crisis that we're dealing with? And once again, oftentimes in training exercises, this is the stuff that's harder to measure. It's harder to put into play. It's harder to talk about afterwards and to debrief, but these are the conversations that we do need to have, partly because what we're interested in is not escalating a crisis that we're trying to address. And somehow, and sometimes, lack of acknowledgement of things that are going on, like what Peter said, lack of acknowledgement to some will be interpreted as complacency. And so you don't have to say, we think this. By not acting in a certain way, or not maintaining consistent messaging, or not putting out the messages that are holistic, are you being seen as part of the issue? An example that you may be seeing is that there's a lot of great social media stuff that's going out right now, and we're seeing it from all of our wonderful agencies, but a lot of it is only going out in English. And so what message does that send to non-English speaking or even immigrant populations in your community, where you're trying to build a community with those awesome social media things, but actually you're creating the idea that only some people are in your community and sort of should see those and others not. So those are the sorts of things that we really do try to insert into our exercises so that we are better equipped to be able to think about all of the levels of conflict and all of the levels of crisis, so that we can avoid things that we know are there, possibly come up with new ideas and open up that space for creativity, which at the end may have been an event now for trust building, peace building, or whatever you'd like to call it. These are the situations where that space can open up. So I'm going to end it there myself, and at this point pass it over. And once again, if you've got some questions about this, I'd be happy to go into it further.
Thank you, Jess. And so we'll turn the slideshow off for a moment, and we'll take some questions from folks. We're going to ask people to send them to the chat box if they can. And I've got a couple questions that we can look at really briefly. I actually want to comment on something that both Jess and Peter kind of said together, which I thought was interesting. And I just posed something in my own community. And I live in a community outside of Washington, D.C. We are a minority-majority community. There's no particular group that's a majority in our city. And our city is about 25 to 30% Latino, and language is, Spanish is their first language. So the city has put up signs in all the parks and everywhere, big bold red signs that park is closed and these are things you can't do. Signs are only in English. They're not in Spanish. And one of the things in going in walks in my neighborhood that I've noticed is that where we have seen people going, and once again, I'm not generalizing or stereotyping, but where I see people going into the park, I'm suspecting some of them may be Spanish speakers who reading English is not their first language. So they're seeing the red sign, maybe they're not quite understanding the red sign and they're going right in. So this is a really good example of the failure of communication, and what Jess is acknowledging, that recognizing that we have to serve the population. We need to warn and we need to recognize how they're understanding and how you're understanding it. And even though there may be a policy, well, everyone should speak English, that's not the reality in the United States. Certainly it's not the reality in other places. So a couple questions here. Let me go back, and what I'll do is I'll kind of throw the questions out. There was a question here from Will, and I thought this was a good question. How do any strategies for streamlining the flow of information? Do you have any strategies for streamlining the flow of information so that there isn't the potential for broken promises that snowball into mistrust and a potential safety risk? So Peter, maybe you can take a crack on that, and then if Jess and Lena want to add to that.
Okay, one of the first things I would say is it is in the field simulations that we run, we tend to have a morning briefing with every player, every future humanitarian who is going to be put into situations where he will be faced with difficult choices and ethical problems. But they should all understand by the time they leave the room where they've been told what the day's activities are, what they have available, what the policies are, who gets what if we have things to distribute or tents to build. So they should all have full knowledge of what's actually available. And they should not at any time during the day, and they will be pressed over and over again to support a particular community, a particular family. Occasionally, we have to teach people to be quite hard in saying, we're here to do this thing, we cannot help you with that, because that's not our task right now. And it's quite difficult for some people who are faced with particularly difficult situations where babies are crying, there is no milk powder and things like that, to say, oh, I will do my very best to help you, but I can't promise anything. I mean, that's really hard. But that's part of the task. Jess, I know you're nodding. I can.
Yes, well, I would like to jump in too. So my experience is mainly within the U.S. and is a domestic. And once again, there are a couple things that I would recommend, or that really we're taught within the emergency management world that sometimes we sort of let go, is that number one, you need one person who is funneling that. You need a public information officer. You need someone who knows what messages are going in and out. And it is very often we either see that no one wants to be that person, when actually everyone should be able to be that person. Everyone, when there's not a crisis, everyone should be going through education about how to talk to the public, how to look at social media, how to understand it. Where does your social media come from? Do you have a website? Do you have a Facebook page? Do you have a Twitter? How that works. Domestically, we often talk about this as intelligence gathering and intelligence distribution. We're not talking about espionage. We're talking about public messaging, right? And sometimes in the fear of not wanting to be the one to have to deal with that, what tends to end up is that multiple people take on the role because they think they need to answer fast. And when you answer fast, you're more likely to make mistakes than if you answer going up and down the chain. And so part of it, and what we try to practice, is people need to know how to say, I don't know. We will get that information. We will be able to give that out. I would agree on the debriefing and the briefing sessions too, and also making sure that those briefing and debriefing sessions are in plain language, and that you include your other partners, right? So that other partners understand what's going on. Very often in the analysis of after action things where things went wrong. Is that the communication wasn't delivered in a way that other agencies understand, or wasn't put into a way that sort of made sense to everyone, but no one wanted to ask. So the biggest thing is one role, there's a chain that has to go with that. Everyone should know how to do that so that you're not looking for someone who can and potentially not have anyone, and be willing to not answer the question right away, to be able to come back of, I don't know, but here's how we're going to get that information to you.
Thanks, Jess.
Can I just add one more thing? In slightly larger organizations which have a country manager or someone who is in overall charge, the public information officer should be living in that person's pocket, he or she, because that's where it all stems from. That's where the strategic direction for the messaging comes from, because certain sections of the population may get different messages, but the public information officer, call it what you will, needs to be on exactly the same page as the overall person in charge, and that's where it stems from.
And when you're training, put in an insert that it goes wrong. Don't let it go right in your training. Your training is a place for it to go wrong, so you can figure out where those weaknesses are.
Yeah, I mean, training is all about learning, right? And learning comes about through not getting it quite right, right? And kind of learning from that. So that's really important, and something we really try to emphasize in our own work. So the next question is from Preeti. How does one build capacity building, and in that line, trust building? I believe that when you trust yourself, you build trust with others, specifically in context of situations such as COVID-19 and other humanitarian-based contexts. I would like to start off taking that. So it's really a trust building question.
I guess I can start with that, and then I'll leave on. One of the mistakes sometimes that we make, or it's not really a mistake, it's an assumption, is that we are trustable and people will understand that. And we forget that we're wearing a uniform, right? Out in the world, if you're part of a humanitarian organization and you wear a uniform, you are not the individual, you are the uniform. And if there is an issue with that uniform, or if there's a narrative in the community that where that uniform in some way has not performed up to the expectations of the community members, you in that, now you have a role in changing that. Everyone has a role in changing it, but what we often see is people getting very irritated or angry that people aren't looking beyond and saying, but this is me and I'm trustable, right? So if you're seeing those issues, and again, this is why we put these into our trainings, because we tend to think of ourselves as individuals, not members of agencies necessarily, then we can go back and say, gosh, this is how it made me feel. This is how I almost responded, but now here's how I went back, got that information. And then when I went out again and delivered that, you did that tiny bit, you changed that narrative. So on one hand, we are individuals, and that's very important. And it's always important to remember what we look like when we're in the clothes that we are in. But at the same part, you are part of an institution, and those institutions have longer memories, longer narratives. There are some organizations here in the US that are dealing with things that happened 50, 60 years ago, that even in interacting with the public, they will bring those things up. And so that's important to always remember that part of your capacity building is acknowledging where things may have gone wrong in the past and not replicating those.
I also wanted to add that, I don't have the picture, David. I wanted to add that in public health, one of the major principles is that you cannot create programs, you cannot provide services for people for a particular item unless there's a desire for it. And how do you know what the desire is unless you include them in the process of creating the priorities? And so that's one of the areas I think that we find a lot in our simulations, is that the participants often think, well, I'm here to help you. Don't you want it? And so they're often dealt with the situation where, did you even ask us what we want? And so talking and bringing the parties together and helping them and helping the participants see that you have to include all the community members in the development of the program, I think is critical to creating trust. If they feel like they're part of the process of creation, not just the recipients, it brings interest, and trust is developed just that way.
Did that answer the question, or did someone want to add more?
All right. So I got another question here. So this question is from Samia. Do you think delivering information in other languages should be done by government or humanitarian organizations? And what is the best ways to participate in that? So in other words, who should be kind of in the forefront of the various communications that may be necessary, particularly when it comes to language?
I'll let Peter answer, and then
Once I find my unmute button, I'll be happy to answer. We have difficulty in the sort of field trainings that we run, where we occasionally pretend that we are dealing with an object population which speaks a different language to us. And we have come to realize that we are not we're not linguistically qualified to do that. Now, I can understand the question. For example, my answer for the Rockville solution would be, it cannot be that difficult to produce a sign for a park which says no entry because of COVID in English, and then have it in Spanish underneath, depending on what the percentages of population are. I know for a fact there are something like 56 different nationalities that live in downtown DC, and I cannot see a no entry sign in 56 different languages being pushed up. So there has to be a bit of take and give. I believe where appropriate and where humanitarian organizations operate, for example, in Somalia or wherever it is, then it is up to them to produce the linguistically correct signs, languages, whatever, purely to engage with the local population whom they're there to assist and serve and everything else. And they will not be able to do so unless they are linguistically capable of doing that. It's slightly more difficult here, where you may have a classroom with 16 different languages. I don't know, Jess, at the university, you've probably just teach in English, but you have 7 different languages spoken in your classroom if you really came down to it.
So I think so I would follow Peter up definitely with, this is also where your partner organizations may really, really help. You may not be able to make a sign in a particular language, but you may have a community organization, a house of worship, a community center that absolutely can, or some of your partner agencies may already have that type of signage, and you just need to ask, right? So for example, there are major humanitarian organizations that have these sorts of signs and brochures and things in a PDF form. You just need to ask. So you don't have to reinvent the wheel, but the wheel's been made, you just need to know to ask for it. And so what I would say is that if messaging is available in different languages from other organizations, could be the government, I would start with using those only because you most likely have an accurate translation and you didn't do it yourself, right? But on that end, what I would also say, and this is why we put this into our exercises, is that you need to already be doing the research as to what are the major spoken languages around you, right? So I live here in New Jersey. It is easy to find, using census data, other demographic data, municipality by municipality, county by county, what are the major languages? Or at least what's the main next language of the largest group of speakers that may be in your area, right? And so there may not be state level things for that. And that's where, again, where you'd pull in those partner organizations, you would already have an idea of who is out in the community. That's why community assessment is so important. And in fact, we often have in our exercises where we don't have that, and there is a community organization out there for that. And part of what our participants have to negotiate through is the fact that we've ignored them, right? So once again, those sorts of things, if you can put them into your training exercises now, it means there's more comfort when it actually does happen and you're able to facilitate that. So that's a very good question. Messaging is so important. And sometimes it just is about where do I get it and who can I ask?
Thanks, Jess and Peter. Now the questions are starting to come in. So another question on communication. So a lot of people are talking about communication, which I think is important right now. What are some strategies for public information officers to get on the same page with persons in charge of resources?
Strategies in the field are that the public information officer is at the daily morning brief and he walks and talks to everybody, as many people as he can, so he gets an accurate situation report from operations, from logistics, from communications. If there are radios off the air, he needs to be able to know that the phones aren't working that day. He's not going to be able to speak to any journalists or community group leaders and things like that. That's a daily thing. He has to be seriously he or she has to be seriously proactive in this, and it's one of the more difficult jobs.
I would add on that in certain areas, in certain contexts, and not everywhere, there are online software programs that people use to resource manage, to know what's there. And as frustrating as it is to have to use them, you need to use them, right? Because that's the only source of information. And so in our training exercises, often what we do is we try to simulate when those things have broken down, when someone didn't enter into something that we got, 15 pallets of water or something like that. And then the messaging got out that water came, no one knew, but it was already distributed, but to a certain neighborhood, right? Because that's what can go wrong. And so part of the role of the public information officer is not sort of to learn about it, 5 minutes before, but then also to talk with the others beforehand, all the stakeholders, and say, this is what we need to know, have a uniform way of reporting it in some way. So if you're not in a place where everything is online or there's internet access, how do you still get that main information to the person who needs to know on a regular basis? And so we actually practice that. And sometimes our participants get so, this is so much work, this takes so much time, why am I doing it? Well, the flip side is the things that we know will go wrong.
Okay, next question is from Marley, and she's an educator. And so she's doing a simulation at her school, cross-cultural management, with the following problem statement. Create a global, cross-cultural, and unified approach to creating structures and dialogues to prevent future pandemics. So it's more of a prevention. How do we prevent future pandemics through cross-cultural and a unified approach? What would anyone have any ideas on that?
Would Lena have anything to say before I jump into preparedness?
Yeah. Your microphone's on.
Still thinking.
Yeah. I think what I would jump in there with is that thank you for even thinking about a preparedness. That very often, we put a lot of investment into response and into recovery, and a dollar of preparedness saves $2 of response and recovery. And so part of what we do have to think about just in our own agencies, and I'm sorry, I forgot the name, but you who asked the question, you are doing this because if we get responders and we get agencies and professionals who are putting as much thought into the preparedness, and certainly we know from the past couple of years and some of the history here, what's happening now was something that we knew was coming. We knew where the weaknesses would be, but because priorities change, we sort of let it go, right? It's the same thing that we saw with hurricane preparedness before a Katrina. And what tends to happen is that we learn from this, and we need to maintain that. So as much messaging and focus that we can keep on preparedness, why it's important to understand a science education, why it's important to understand social studies and things like that, and how they intersect. The fact that you're having your students do that means that when they're in that position, they're thinking more largely than just the tactical response of one event. Alina, did you want to? You're our public health.
The question made me think right away of the Model United Nations. And it made me think about how would you create a simulation where you bring in a lot of different parties, and that cross-cultural would definitely come into play, because the United States, we're thinking someone who represents FEMA, someone who represents the military. Another part of the world, let's say Switzerland, they might not think of that as their first choice when they're considering what do we do to prevent a pandemic, right? And so I think that could be really fascinating to create a lot of different role players from a lot of different spectrums of society to come together and say, well, how do we prevent this in the future? And if it were about to happen, how would we prevent it from spreading?
I have a question for the question setter. Is it at what level are you pitching the simulation? Is it at governmental level, at the strategic level, or is it slightly directors of health and that sort of thing, slightly further down? It will depend how many people you have to get involved in it, obviously.
So I can really open that up. Marley, if you're around.
She said it was at the strategic level.
Yeah,
okay.
I'm going to talk. Okay, the strategic level. Okay.
So we're talking government ministers, prime ministers, presidents of 7 different countries.
7 different countries.
Oh, wow.
Okay, thanks, Marley. You know, one of the things that strikes me about all of this, and this is really kind of the difference between, we'll say, the way the first world, the global north, we'll say, and the global south are positioned right now. I think a lot of what COVID has demonstrated to the global north is this is not a theoretical issue. This has really happened to us. And I think a lot of what the global north has played the role of is observing, assisting, at times dictating, advising the global south into what their problems are and their challenges are when it deals with things like this. So for policy people in the global north, it's often been not an internal reflection as much as an external reflection. So if you look at aid organizations, you look at DFID or you look at USAID, you know, the policies of the global north has been, well, what can we do to help the global south prepare for these things and to be in the best position? Now, for the first time, it's the global north, it's South Korea, it's the United States, it's Europe that's dealing with it. And in a sense, that's not been what we focused on in the past because we didn't think it would ever happen to us. So we were always focused on what we could do to help other people, right? You see what it is, kind of a different way that we've been positioned because of that. And so makers have to think differently. Go ahead, Jess.
I would also throw in, and this is a very unfortunate thing, but if you're dealing at the strategic level, we've already seen with the COVID response how quickly narratives of nationalism and border making began to fuel the strategy. And of course, so when we talk about a community level attention, now we're at sort of that nation level attention, right? And particularly with a disease, viruses don't have a passport and don't know when to go through a checkpoint, right? And how can we move, because we've seen the destructiveness that some of this nationalism that has come into the strategies, what it's done to communities and how it's halted some of our response. And so what I would definitely say is that in any scenario or thing that you introduce that idea of in the way that you can, where nationalism can kind of raise itself and be a hindrance, right? That this is not something that, you know, good Americans know how to fight, or if they just weren't let in, or if they just knew to, you know, do what they do, that this really is a global thing. And that it's these events that create that space, again, for creativity, but it creates the space for escalation of those very negative things that unfortunately we've seen even with the COVID response.
So we only have a few more minutes, and I've got a number of questions that are coming in. I want to get to them. So Will has a question. When is developing trainings, how much is too much? When developing trainings, how much is too much? Is there a threshold we should look out for if the participants are too overwhelmed and not able to process what's happening? So 1 or 2 thoroughly developed major tracks, or smaller, more broad tracks. Does anyone want to kind of take that? It's really looking at the
I want to ask Will, how long is a piece of string? We have wrestled this in this group here for the last 10 years. How much is too much? We have tried to stress in a contained and thoroughly controlled environment our students, some of whom find out that this is not the work that they want to do at the end of the day, which is probably a good thing. Rather, they call it quits when they are put under a little bit of stress in the sort of environment that we produce, than finding it out in, you know, the back valleys of Afghanistan or wherever it is, when they suddenly decide to go tilt. Now, having said all that, we have, over the last few years, detuned our stressful situations somewhat, having had 1 or 2 experiences with people who became overwhelmed in the field with us. And we are extremely mindful of the mental impact that some of those situations can have on young people. And I would hate to be responsible for someone's mental health suffering because of what we've done. We do not do anything that's outrageous. Director of Education will.
You know, one of the things that I was thinking about too is that as much as we want to throw everything in, like let's make a stew, right? We also have to think about, what are you assessing? And so in the end, and there's different types of trainings, right? There's tabletops, there's full immersions, sort of all of those things. Maybe you want to gradually work in certain things where you practice at the tabletop or the seminar first in sort of smaller ways before you dump everyone into a full immersion exercise. And also thinking about that, what is, you know, what are the main things that you want to do in this way? So where do you want to push the stress, and sort of where don't you, so that you're not pushing the stress in every way, because then you can't assess it. Afterwards, you can't evaluate and say, it was really this thing that went or that sort of people began to break down with, or it was this thing. Then you don't really know. And so that's why a training program is really important, because then you can begin to see, are there competencies or skill sets that just seem to need to be exercised more at lower levels, and then brought out in larger scenarios, right? So there's a lot of ways of looking at it, but you're exactly right. We do want to also maintain the mental health of our people who are putting themselves into educational opportunities. So that's a very good question.
So let me take another question. I have another question from Cody. From your professional insights, what is one of the most valuable learning opportunities raised so far from COVID-19 responses that previous pandemic simulation models may have overlooked or underestimated? I.e., what is something that we have learned which we didn't realize before?
So I wish I could say that we didn't know it before, but we did. And again, this is coming from a social science background, how quickly the threat was humanized to certain people. And that if those certain people were just contained or kept out of a community or things like that, then we'd all be safe. That transition from a natural threat, I mean, disease is a natural born threat, and how quickly it was securitized into threats by humans. And we've known this for a long time. We see it happen with natural disasters. I mean, I'm a historian at heart, and so I can go back 100 years and find the same things happen each time. And that's why we put it in our exercises, because we seem to be surprised every time. And in fact, it's the one thing that we shouldn't be surprised. There's usually a scapegoat or a target population that's sort of focused on as the source of all things wrong. And we know what negative outcomes can happen from that.
Now, I don't know if this is something that we have learned or will learn, but I am speculating that the long-term mental health of everyone around the world and PTSD following this, I'm very curious as to what the impacts are going to be. I just read somewhere someone was saying, remember when you made fun of your grandmother because she would get the groceries and wash everything off with Lysol disinfectants? Now we are going to be the grandmothers and grandfathers who are doing that, and young people are going to be saying, what are you doing that for? I think it's fascinating, scary, and I really hope that we put resources into providing people with the mental health resources that they're going to need.
So I think we're just about at 5 o'clock, and so what I want to do is we're going to bring our hour to a close, and I'm going to put in the text box, or I'm going to have Catherine Kozar, who's been our backup, put in the text box Peter, Jess, Lena, and my email, if she can do that, so that if you want to contact us individually, that's there. But then we also will be reaching out to you all individually with regard to a survey that you can contact also.
And if I could just,
go ahead, yes, please.
Okay, yes, that survey will have an opportunity for you to say, what other topics would you like to see that are relevant to the way that we train and educate? And if you can give us those ideas, and I'm sure there was a lot more in the chat box, we would love to hear from you, because we want to be responsive to those who are wondering what they can do. So as Director of Education and Training, I want to thank you for your hopeful anticipation of filling out the survey.
Peter, did you want to add anything? Peter's good. Okay. I think there's one more slide. Well, our contact information slide. Jess, can you show that? Is there one more slide that we were going to show?
Yeah.
Catherine?
Catherine, yep.
Well, maybe not. So you can reach us at there we go.
Here it is.
Here it is. And there we are. So there's our contact information. If you want to reach out to us, we are going to continue to think about, as Jess said, think about additional programs we can be doing in this fashion. This is really a new learning environment for all of us, and it has tremendous opportunity. And we're hoping that once we are back to normal, or what we might call the new normal, that we will be back working in a simulation experiential based environment, doing the work that we do at our site in Western Maryland, and doing the programs that we're doing colleges and universities and on site. So if you're interested in finding out about those programs, things we've done in the past, please reach out to us and visit our website, foragecenter.org. So thank you very much from Washington, D.C. Have a great evening. And I want to thank Lena, Peter, and Jess, and Catherine for backup. And we'll be back in touch, and hopefully we'll be back in a Zoom call at 1 soon. So thank you so much. Bye-bye.